I'd like to welcome everybody to today's presentation. Before we get started, I wanted to remind you that we do have an intensive wellness retreat and conference coming up the week before or right up until Valentine's Day in February of 2021. So if you're interested in earning up to 30 live CEUs, or you and your significant other just want to attend the wellness retreat, then you can go to allceus.com/cruise and learn more. Today, we're going to be talking about hepatitis and blood-borne pathogens. Now, that may not seem like a super exciting topic, but it actually does impact a lot more of our clients than you might think. I am your host, Dr. Dawn-Elise Snipes. Today, what we're going to do is hit the highlights. I have another presentation coming up next week, I believe, that's going to go a little more in depth, but we're going to hit the highlights on current information about the prevention, transmission, and treatment of a variety of blood-borne pathogens. And we'll review current information about hepatitis transmission, symptoms, and treatment. World Hepatitis Day is coming up on the 28th of this month. So that's something we do want to take advantage of and educate our clients about all the different forms of hepatitis, A, B, C, and that there's actually a D and an E now. There are over 650,000 to 900,000 people in the United States alone living with HIV. There's approximately 3.2 million people in the US living with hepatitis B or C, and those are the viral types of hepatitis that are potentially recurrent. Hepatitis A, on the other hand, is spread by close personal contact with people or things contaminated with feces. And you might think, well, who does that? Well, if somebody goes to the bathroom and then doesn't wash their hands and goes and prepares food, they can transmit that. If you've got small children in the household, especially ones that aren't old enough to wash their hands, we know babies' hands kind of go everywhere. And so then they put their hands into your mouth. And so it is possible to get hepatitis A that way. Now, the good thing is that hepatitis A actually tends to go away on its own. We're going to talk about a little bit more about that in a minute. HIV and hepatitis B and C are most easily transmitted by contaminated blood and bodily fluids. So this is where we get into our blood-borne pathogens, and in treatment centers, we need to be cognizant of these things. Especially, when there's the potential for the transmission of blood and bodily fluids. The incidence of hepatitis C among people who are heavy consumers of alcohol is 7 times higher than in the general population. And they define heavy consumers as 4 to 5 alcoholic drinks a day. And think about people who you don't typically think of as necessarily heavy drinkers, but who drink 4 glasses of wine or 4 beers every evening. That is considered a heavy drinker. Now, the hepatitis C is different than alcoholic hepatitis, and we're going to get into that in a minute. But it is important to recognize that those who have the hepatitis C virus in their bodies are more apt to have clinical symptoms of hepatitis C when they are drinking a lot, because alcohol reduces your immunity. We do know, or we do have vaccines for hepatitis A and B. Now, I thought this was an interesting little chart, and I don't usually use a lot of charts, but during 2016 to 2018, reports of hepatitis A infections in the United States increased by almost 300% compared to 2013 and 2015. Now, a lot of that is due to poor food processing, hygiene, and those types of outbreaks. If you remember, periodically stuff gets recalled because it's contaminated with a variety of things. The other thing that we've noticed is that alcoholism is increasing, which means alcoholic hepatitis is increasing. Global alcohol consumption is up 70% between 1990 and 2017, from 21 million liters per year to roughly 35.5 million liters per year. Now, that's not population adjusted. And why is that important? Well, if our population went up 70% and our alcohol consumption went up 70%, it wouldn't be all that concerning necessarily. But you can see between 1987, if you want to, or you can go up to 1990, we went from 5.25 billion to 8 billion. That is not a 70% increase. So we do need to recognize that the stats indicate that there is more alcohol consumption, a greater percentage of people are consuming alcohol. 2017 put high-risk drinking among women at a 58% increase in the last decade. Wow. Okay. So there's a lot more high-risk drinking among women. And alcohol distributors reported a 50% increase in the sales of alcohol from 1 week in March of the coronavirus compared to the same week a year ago. So we can anticipate that there is going to be an increase in the number of people who may be struggling with substance misuse issues or who are self-medicating with alcohol while they are on lockdown, who may present later with mood disorders that need to be treated. But it is important to recognize how much alcohol use has increased. The other thing to kind of factor into that is a year ago, before coronavirus, the bars and stuff were open. And during coronavirus, the bars, in large part, were not open. So a lot of this increase is due to sales to the home consumer. So just kind of something to think about. Alcoholic hepatitis is caused by drinking too much alcohol and occurs in 20% of alcoholics, or approximately 3 million people. So add that to the millions who have other types of hepatitis. You've got millions and millions of people who are struggling or may have symptoms of hepatitis. Now, the thing, just kind of to go back to, Latin 101, when you separate these words, hepatic means liver and itis means inflammation. It doesn't necessarily mean a virus. And a lot of people think, well, hepatitis is always a virus. No, it's not always a virus. Alcoholic hepatitis occurs when the liver gets inflamed because it's being exposed to too much alcohol. Severe alcoholic hepatitis can develop suddenly and quickly lead to liver failure and death. We need to educate people about some of the risks, and we'll get into that in a minute. Symptoms of viral hepatitis. They're similar no matter which type of hepatitis you have. It includes jaundice, which is yellowing of the whites of the eyes and a yellowing of the skin. A lot of us, if you've had children, your child may have gone through a period where they got a little jaundiced. Both of mine were preemies and ended up having to be under special lights in order to help with the jaundice. But jaundice is one of those symptoms. And a lot of times in people who are heavier drinkers, you may start to see this as a symptom. You start to see their eyes becoming more yellow. Fever, loss of appetite, fatigue, dark urine, joint and abdominal pain. They've got that liver is getting inflamed, so that's going to make their belly hurt. Generally, alcohol is kind of rough on the stomach, so that may make their belly hurt. We know that alcohol is really rough on the pancreas, so that may be going on too. As the liver becomes more inflamed, a lot of times you'll see some abdominal distension. This is in, much later stages, but it is important to recognize that there is pain that goes along with this. It's not just one of those things where you kind of feel like you got the flu for a while or something. It is a systemic, multi-systemic condition. Diarrhea, nausea, and vomiting are also symptoms. Interestingly, depending on the type of hepatitis, the incubation period can be anywhere from 15 days to 6 months. So you could be exposed to something in January and not test positive for it until June or even July. That is important to know, because people who think they've been exposed, if they get tested, just like with HIV, there's a potential incubation period where the person may not show the antibodies for being positive when they actually are positive. So it's important to make sure that they get tested, periodically and up to and including 6 months after exposure. But if they think they've been exposed, obviously the first thing to do is to go see the doctor. A lot of medications are now available to help treat the symptoms or treat the virus. Alcoholic hepatitis, abdominal tenderness or pain, especially over the liver and or pancreas, nausea, vomiting or blood material that looks like coffee grounds. Now, if somebody's throwing up something that looks like coffee grounds, that's cause for concern, with or without pain. Poor appetite, jaundice, weight loss, tiredness and weakness, and fever. Now, I want you to think about some of the things that may be going on right now and how some of these symptoms may overlap with, guess what, COVID, or some of these symptoms may overlap with, guess what, depression. So it is important that we consider all potential diagnostic reasons for these symptoms. And if somebody is, depressed and they're on quarantine right now, or whatever we're calling it at this point, and they're starting to have, tiredness, weakness, weight loss, nausea, poor appetite, all of those things could be a bunch of different issues. But if we also know that they've started drinking more since being on COVID lockdown or whatever, it is important to make sure that they get a referral so they can get early intervention. Hepatitis A is not a chronic illness, but about 15% of people will have prolonged symptoms lasting up to 6 months. We don't want to minimize their issues. They may have prolonged issues with fatigue and joint pain or abdominal pain. And all of those things are going to significantly impact, potentially, their mood, their productivity, their motivation. Chronic hepatitis B infection occurs in less than 5% of people infected after age 5. And this isn't just because more people have a Hep B vaccination, but it is interesting to note that the chronic hepatitis B is only in, a very small proportion of the population. Chronic hepatitis C infection, however, occurs in 75 to 85% of newly infected people. That's important to know. We want to make sure that people who think they may have been exposed to hepatitis C are tested. And ideally, people are tested, annually when they get their blood workup done, just to make sure that, they're screened for HIV, hepatitis, thyroid issues, hormone issues, all that stuff, in an ideal world. 70% of people chronically infected with hepatitis C go on to develop chronic liver disease. And that is when we start really seeing a lot of challenges with fatigue, nausea, jaundice, pain, and co-occurring issues that need to be addressed in addition to just mood or just substance use. But the good news is over 90% of people can be cured of the hepatitis C virus. So we want to make sure that people get in there and get treatment. There are good treatments out there now that are effective. Drinking while you've got hepatitis C is a big no-go. It works against the recovery process. In 2019, researchers found a promising drug that might even cure hepatitis B virus. It hasn't been cleared by the FDA yet, to my knowledge, but it is important to note that we are making strides with not only the treatment of the symptoms, but eradicating of the virus in people who contract hepatitis B or C. In the US, about 20,000 people die each year from hepatitis C. People who have chronic hepatitis B or C infection have a much higher risk of liver failure and liver cancer. Now, if there was no other reason to avoid heavy drinking and pay attention to transmission of bodily fluids than that, I think that would be a good motivator for people. Liver failure means you're going to have a liver transplant. You can't live without a liver. And liver cancer, well, you know, cancer is cancer. And there are treatments and yada, yada. But, you know, if one of the things that you can, or two of the things that you can do are to practice good hygiene and to not heavily consume alcohol, those seem pretty reasonable steps to take. We want to enhance health literacy in our clients, not just necessarily treat their presenting issues, but make sure that they're aware of ways that they can prevent themselves from developing, you know, ancillary issues like hepatitis or HIV. Alcohol and drug use can interfere with HIV and hepatitis medications. You know, that's another, you know, not only does alcohol and drug use reduce your immunity and make it more easier for the virus to, you know, flourish within your body, but it also actually counteracts or interferes with the medications you're taking if you're trying to recover. Alcohol and drug use, we also know, tends to lead to poor health behaviors, which further compromises immunity. Now, I'm not talking about the 1 or 2 drinks some people have in the evening. I'm talking about heavy alcohol and drug use where people are, you know, drinking till they get blackout drunk and they're not, you know, brushing their teeth and taking baths and things like that. So collaborations, when we are working with a client who has hepatitis, and this is something we should be asking if they are aware that they have, you know, hepatitis or HIV or, you know, there are questions we can ask because we can integrate that into the treatment plan. We need to bring in medical providers, mental health providers. If substance use is involved, then substance use providers. Also public health people and social support groups. It's going to be important that somebody living with a chronic illness has social support. And there, you know, we know there are lots of different chronic illnesses that people may have, but it is important to make sure that they are surrounded by a multidisciplinary as well as social support group. Risk factors and prevention, some of the myths. It doesn't matter what you do, you know, you're going to get it, or if you're exposed to it, you're going to get it. You can avoid HIV and hepatitis if you're careful and don't repeat risky behaviors. No, it does matter what you do. It matters if you wash your hands. It matters if you expose yourself to blood or body fluids, and you can get sick from one exposure. It doesn't necessarily take multiple exposures. You cannot necessarily tell if your sex, injection, or other partners are infected. Some, especially with hepatitis, you know, some people think, well, I'm going to be able to see the jaundice, or I'll be able to see that they're wasting and I'll know they're ill. By the time it gets to that point, they're really ill, but they are contagious long before that point. Treat any STDs you have and you won't get HIV or hepatitis. You can have somebody who is an Olympic athlete who is in tip-top physical form and has treated every STD or never gotten one, and they expose themselves to infected blood or bodily fluid, they can get the illness. Washing after sex prevents HIV or hepatitis. No, it doesn't. Let's just put it out there. We don't need to go into details. Not sharing syringes prevents HIV or hepatitis. Well, yes and no. You know, HIV and hepatitis viruses are around, so if the syringe is contaminated and you stick it in your arm, you're potentially going to get sick. It is important, you know, you run a much higher risk if you are sharing syringes, but there are so many other ways to get HIV or hepatitis besides just needle sharing. So prevention measures, use condoms. Don't share syringes. When you are injecting yourself, if you are injecting yourself, use new syringes that are sterile. And this is true not only for, drug use and, harm reduction methods, but also for people who have to inject themselves with different types of medications. If it's insulin or interferon or something, there are people who do have to provide themselves with daily or regular injections. So it's important to make sure that you are using new sterile syringes. Disinfect drug paraphernalia. Now, again, this is a harm reduction strategy. Ideally, don't use drugs, so you don't have to worry about that. Make sure you get medical care before, during, and after pregnancy. The blood-borne pathogens can be transmitted to the baby, especially during delivery, but there are steps that doctors can take in order to minimize the exposure and the risk of the infant. One of these is an elective cesarean delivery. If you're sick, try to avoid reinfection. Don't keep subjecting yourself to additional doses, if you will, of the virus. Observe universal precautions as directed. When you're working with clients, use gloves. If somebody that you're working with has a blood-borne pathogen, hepatitis, I shouldn't just say blood because it's other bodily fluids too. Make sure that they know how it's transmitted. If it's transmitted in saliva, if it's transmitted in breast milk, if it's transmitted in blood, what it's transmitted in, so they can best take the practices they need to take in order to protect the people around them. If you think you've been exposed, talk to a doctor. Get tested. Remember, there is that incubation period, and sometimes, like with if there's a potential exposure for HIV, a lot of times doctors will start medication even before a test comes back positive as a preventative measure. Get tested regularly, especially if you work in an environment in which you are interacting and touching people with some frequency. That can include EMTs, cops, even behavioral health clinicians, and obviously doctors and nurses. If you are in close contact with people, it's important to just regularly get tested. Like I said, it can be part of your annual blood workup. So if you're like me and you've got an issue with needles, it's not a huge big deal, but it is important. Wash your hands thoroughly. And thankfully, that's one thing that COVID has taught us, is how to wash our hands. 20 seconds of scrub-a-dub-dub. And a little side note, because I am obsessive about water, you can, especially if you're using a liquid soap, get your hands damp, turn the water off, scrub-a-dub-dub for 20 seconds or more, and then turn on the water and rinse it off. You don't have to have the water running the entire time. Okay, that's my soapbox. And avoid touching your eyes, nose, and mouth with hands that aren't, just brand spanking new washed, because your hands carry a lot of germs. It doesn't matter, where you are, you're touching things other people have probably touched. In terms of risk reduction counseling, we want to help and support people in encouraging them to understand their need for behavior change. And this seems like common sense now, since we've been talking about it so much for the past 3 months. Why is it important to wash our hands? Why is it important to maintain social distancing to a certain extent? How are different viruses and diseases transmitted? That all goes with health literacy, and it can go a long way to helping our clients live happier, healthier lives. We need to assist addressing cultural practices and beliefs contributing to resisting change. If people don't believe that the treatments are going to help, or they don't believe that hand washing helps or whatever, and they're resistant to change, we need to look at why and address some of those cultural practices. One of the things that we've learned with COVID, and I know I keep getting off onto COVID, but we're right in the midst of it right now. But handshaking has really gone by the wayside. We were going to fist bumps a little bit before that, but we're starting to realize how nasty our hands really are. And that's a cultural practice that we have often used. So, take that hepatitis A example again. You meet somebody, they just went to the bathroom and didn't wash their hands, and you shake hands with them, then you've potentially got hepatitis A germs on your hands. Then you touch your face and you've been potentially contaminated. So it is important to look at all of the ways that we can reduce our risk. And we want to assist in skills development to sustain behavior change. We don't want to make this hard. We don't want to make this unpleasant for people. Encourage them to, washing your hands after you go to the bathroom. That's not that hard. What other skills? How can we encourage people to be more prepared? And a lot of it comes down to preparedness. Have condoms with you. Don't, get caught unawares. Make sure that you have hand sanitizer with you or soap, at all of your sinks in order to encourage hand washing. There are a lot of times people will, think they're getting ready to wash their hands, and they go to the sink and there's no soap there, and they're like, whatever, and they walk out. Well, now they're walking around spreading those germs. So make sure soap is available. Pre- and post-test counseling by a trained HIV and blood-borne pathogens clinician is important. If somebody is concerned about whether they got, one of these issues, it's important for the person working with them before the test to communicate with them about, what the test is going to be like, what it'll show, the incubation period, and potential treatments that are out there. We want people, if they're going into the test, we don't want them to be waiting on the results and freaking out. If they are stressed out, guess what? They're probably not going to sleep as well, which reduces their immunity. And they may turn to self-medicating with alcohol or drugs to quell the stress, which reduces their immunity. We don't want that. We don't want people to be in this state of panic. So pre-test counseling means talking to people and saying, okay, let's talk about your risks. Let's put it all out here and let's look at probability. We talk about cognitive processing and challenging questions. Have them identify the facts supporting the notion that they have been exposed and they are going to be positive. Have them identify the facts supporting the notion that, okay, maybe they were exposed, but, maybe they're not positive. So they're arguing both sides, but also talk with them about probability. What is the probability that with your history, you have been exposed? What is the probability that that exposure might lead to you being positive? And what is the probability, follow it all the way out through the catastrophe. What is the probability that if you test positive with this disease, that it's going to kill you? Because that's really where people go. They go to this, oh my gosh, I've got hepatitis C, my liver is going to fail and I'm going to die. Or I've got HIV and I'm going to die. People start thinking very catastrophically about some of these chronic conditions. And thankfully, compared to, the 1980s, medicine has come so far that people with any of these conditions really can live a very high quality, rich, and meaningful life. And it's important people have hope going into it. And then when the test comes back, it's also important, again, to reiterate the fact that there is an incubation period, so they need to continue to get retested, that it's important for them not to expose themselves again, even if they think they're positive or whatever. Additional exposures is only going to work against them. So how can they be safe? And if they haven't been exposed, again, how can they be safe? We want to educate them on that. And, we want to talk to them. If they came back positive, okay, Let's talk about your referrals. Let's talk about your treatment options, and reiterate the message of hope. Reiterate the message that it's not ideal. It's not what you wanted. However, let's look at people with this condition that are living rich and meaningful lives. Let's look at what this really means, factually and probabilistically. Counseling needs to explain the limitations of tests as well. Like I mentioned already, the incubation period, but also the risk of false positives and false negatives. Now, false positives are, the test comes back and it says you've got hepatitis or you've got HIV when you really don't. False negatives mean the test comes back and says you're clean and you really do have the virus. So it is important to make sure that if it comes back as a positive, that people are aware that there is a margin of error in all testing and they have another test done. If it comes back negative, again, reiterate that there is a margin of error and there's an incubation period. So it is important to get retested at some predefined time. Different agencies have different time blocks. Sometimes it's monthly, sometimes it's quarterly. We want to help people assess their current risks in their behavior, help them with that health literacy. And it doesn't have to be this long drawn out thing. Give them a handout that has, the 15 ways that HIV or hepatitis can be transmitted, and then go through the list with them. Just talk about, are any of these risk factors that you have? And if so, how can we mitigate those risks? We want to encourage and reinforce behavior change. They come in, they're being tested. Generally, it's because they're concerned that they've been exposed. And sometimes people feel helpless and powerless at that point. They feel like, well, I've already got it. My life is over. Going back to that, we need to promote the idea of hope. That is so important. While they're waiting for their tests to come back, it's important that they still engage in proper health practices and mitigate their risks as much as possible. So we want to reinforce that behavior change and let them know that, these things, even if you haven't done them up until now, these things can help you from getting sicker, even if you do happen to have the virus. And then obviously we're going to refer infected clients for medical care and any other services that they might need. All states at this point in time require reporting AIDS cases to the health department, and it goes up to the CDC or whatever. Some states require that testers report HIV cases. The CDC currently recommends that all states and territories conduct surveillance for acute viral hepatitis, including hepatitis A, B, and C, and non-ABC hepatitis, which are your D's and E's. Interestingly enough, they're really not tracking alcoholic hepatitis. So if the person has hepatitis but actually does not have any hepatitis C in their system, those don't get reported. So we're not getting a super clear picture. All of these reports from your health department end up getting forwarded to the CDC. And if you are the person who is the mandatory reporter, then it's important to be aware of what the state laws are in your area regarding reporting client identifying information for, as we well know now, contact tracing. Factors that contribute to non-compliance of a treatment regimen: addiction or mental health relapse. Sometimes the stress of getting diagnosed can throw people into a tailspin. And if they withdraw into their addiction or into their depression, they may not have the energy or the wherewithal or the cognitive clarity to comply with their treatment regimen or recommendations. Some of these regimens, especially the HIV regimens, can be kind of complicated. Living in an institution is another factor for non-compliance. And when we're talking about institutions, generally we're talking about prison or jails. If somebody is in a psych hospital, for example, then, or an extended care facility, for example, a lot of times the medical staff there will make sure that they are compliant, at least with their medication. Side effects are a huge issue, though. Regardless of the medication, there are side effects, and some of them can be doozies, especially, and I haven't talked to anybody in the past couple of years who have been on any of the newer HIV medications, but at least some of the older generation HIV medications could contribute to some pretty significant side effects, including, vomiting, feeling like you had the flu, exhaustion, and they were having to take that, every day of their life, and helping them cope with the side effects instead of discontinuing their medication, which is, a real bad thing to do, helping them figure out how to mitigate the side effects. And sometimes that's cognitive, sometimes we have to work with the physician, but it is important to recognize and empathize with them that, yeah, these side effects really suck right now, and help them figure out what they can do to live their highest quality of life and take their medication. And finally, affordability. Unfortunately, that's still an issue. Now, remember, if your clients cannot afford their medications, go to the pharmaceutical company that makes those medications, go to their website. A lot of times they've got a patient assistance program, and you can look, and generally it's a one-page file, one-page thing that the doctor has to fill out and fax in. And a lot of times clients will be able to get their medication for very reasonable prices, if not free. You can also look for other patient assistance programs online, as well as, and kind of my final, drop back and punt is to go to other sites like GoodRx to see if they have discounts on the medication. To increase compliance, write down instructions. It doesn't matter if they're taking 1 pill or 31 pills, and I'm exaggerating here, but write down the instructions, when they're supposed to take it, if they're not supposed to eat certain foods with it, or if they need to take it with food. Write it down, preferably on a piece of paper, because I don't know about you, but in the morning when I get up and our dog is on a lot of medication for heart failure, and I'm trying to see the writing on the medicine bottle, and it's like micro type, and usually I don't have my glasses on yet. So it's difficult for me to figure out, which pill do I have in my hand, yada, yada, without going and finding my glasses. Now, a lot of people, if they, try to figure out what medication and they don't have their glasses or they can't read it, they'll say, oh, I'll do it later. And then they forget to take their medication. So write it down. My daughter wrote me the instructions for her dog before she left town, and she made sure to type it all out in 16-point font so I could read it and put it on the fridge. God bless her. Anyhow, use a timer, ensuring proper dosing. You can get wonderful apps now on your phone that bug the heck out of you to take your medication. I am one of those people who is horrible about remembering to take my midday dose. If I have an antibiotic that I've got to take like every 6 hours, I will forget. It's just, I will. So you can get some of these apps now. They're free. They're super useful. Another thing you can do is use a check sheet which notes the dosage. So if you're only taking it once a day, having a check sheet on the refrigerator, for example, where you check off after you take your medication, so you don't walk around, 3 hours later going, did I remember to take that today? We want to provide positive feedback to clients when they are compliant with their treatment plan, when they're taking their medications and that sort of thing. Again, empathize and advocate regarding their side effects. If they are really struggling, it's important for us to encourage them to self-advocate with their prescribing physician to help them figure out how to ameliorate the side effects. But if they're not willing to do that, or they feel afraid of doing that, then we can get permission to work to communicate with the medical provider with them. I try not to do it instead of them. I want to do it with them to help them advocate for themselves. If you're working with somebody who has impaired language or cognitive abilities, or even if they are just super clinically depressed, sometimes it can be helpful to have visual cues up there. In order to avoid drug resistance, this is a real simple one. Take all medications as prescribed. This is why it's so important to take the medications. If you only take 80% of them, then you may only get rid of 80% of the virus. And then that 20% that's left over may flare up again, but that 20% is probably more resistant to the drug than the 80% that already got killed off. So now you've got, this 20% that's reproducing, that's more resistant. You do that enough times, you end up with drug-resistant bacteria. Drug interactions, that's another biggie. HIV medications may interact with methadone levels, and, different HIV medications interact differently. They may interact with antacids and drugs that induce or inhibit the enzyme CYP3A4. And that's like most drugs out there. So, and a lot of your over-the-counter herbs and those sorts of things. Erythromycin, which is an antibiotic. Ketoconazole, which is I want to say antiparasitic. Golden seal, grapefruit, the food, St. John's wort, and glucocorticoids like prednisone and much more. So I did find a really cool site, that I want to show you guys. And this same place has a HIV drug interaction checker as well as a hepatitis drug interaction checker. It's so you can click on the link and then start drug selection. And it asks you to select which drugs the person is on. And then you can look at interactions that may be occurring. So you can do that for, like I said, there are different checkers for the HIV drug versus the hepatitis drugs. You can also go to drugs.com. Y'all know this is one of my favorites because it isn't all drugs everywhere. You type in all of the different drugs and vitamins and things the person is on. It creates a list, and then it tells you about the drug interactions that may or may not be there. Obviously, we're not prescribing physicians, so we are not going to tell someone to discontinue their meds. And sometimes, like in the case of psychotropics, it's frequent that you see somebody prescribed an SSRI like Zoloft as well as buspirone. Now, technically, those have a significant negative interaction. However, a lot of physicians prescribe it and find it to be, the risk is, or the benefits are worth the risk, I guess. So we don't want to freak people out either by saying, oh my gosh, there's a major interaction. Just let them know that there's a possibility of a major interaction, and if they're concerned about it, to talk with their doctor. But it's also helpful for them so they can go to these websites if they want to, start taking some vitamin or herb, or they read about this online. CBD oil is, all the rage right now, and yes, it interacts with these things. So, they can go and learn about how it interacts and, then talk with their doctor with a little bit more education. When we're working with clients and we're talking about things like hepatitis and HIV, it can be really embarrassing for people if it was, if they got it through sexual contact, or just the stigma surrounding having hepatitis or HIV can be really embarrassing for people. So it's important that we learn sensitivity, and that learn stands for listen with empathy and understanding. Elicit cultural information. What is it that you think causes this? Why is it that you think you're struggling with it? What are your cultural beliefs about having this? And you'll develop your own set of questions in order to elicit the cultural information. It's also helpful for the cultural information to do your research ahead of time. If you're working with clients who are Asian, if you're working with clients who are Hispanic, if you're working with clients who are Black or African American, do your research ahead of time to find out, what does that culture believe about HIV and hepatitis and some of those other things. Acknowledge and discuss cultural differences and similarities. Recommend action, treatment, and intervention that incorporates cultural knowledge. Now, if this is a hugely shameful thing, one of your recommendations is not going to necessarily be go back and tell your whole family that this is what you've got and, educate everybody about how they can stay safe. That is probably not going to happen if somebody is cloaked in a lot of shame. And that's an issue that we will need to deal with in counseling. But we do need to be sensitive to the reaction of their support system and their beliefs based in their cultural history. And then negotiate agreements and differences with the client. If the client, for example, doesn't believe in taking medication and is adamant that they're not going to take the medication that could cure them, we can't force them to do that. So we do need to negotiate agreements such as, okay, if you're not willing to take the medication, what are you willing to do in order to keep yourself as healthy as possible for as long as possible? Relapse prevention, events that can initiate a relapse. And that means they can go back into a major depressive episode. They can relapse in their anxiety. They can have relapses of panic disorder. Remember, relapse just means a return to a prior state. Taking a test can cause a client to relapse. When you're take any kind of at least for me, when I take any kind of test, I'm a little anxious about what it's going to say. And if I'm taking an HIV or a hepatitis test and I thought I was exposed, then I'm a little bit more anxious about what it might say. So we need to help them develop skills to deal with the anxiety and the ambiguity until they get the information. Receiving test results can be overwhelming. Some people just won't even show up for the test results because they're so afraid of what it's going to say that precipitates a relapse. They can't go there. We do need to, again, push that message of hope before the testing. Push that message of hope when we call them in to get their test results. Experiencing first symptoms of the disease, obviously, if they have it, whether it is jaundice or belly pain or first symptoms of HIV, this can be hugely triggering because the person might feel like, oh, here we go. It's all downhill from here. And that catastrophic thinking just kind of snowballs. We do need to recognize that and help them address their cognitive distortions, as well as develop some distress tolerance skills and calm that monkey mind. Because if their mind is always going to that dark place, anytime that they're not totally occupied with something else, that is going to be a huge stressor on their system, which is going to reduce their immunity. Experiencing their first disease-related hospitalization, being diagnosed with AIDS or liver cancer or liver failure, being put into the hospital is a big deal. Being diagnosed with full-blown AIDS or something that is potentially lethal, deadly, that is a huge big deal for people. And they're going to have a grieving process that they need to go through. If they test positive, when they have their first symptoms, when they have their first hospitalization, that's going to reignite that grief process for a lot of people every single, progressive step. If they have a friend or significant other that dies from AIDS or liver disease or liver cancer, they watch that person, go down the path towards death, and it can be terrifying. And it can increase their sense of hopelessness and helplessness, which often contributes to treatment noncompliance. We do need to work with them to identify, what are the differences between you and that person? In what ways is your body stronger? What are you doing to take care of yourself that maybe that person didn't do? Help them see how, they've got a fighting chance, so to speak. Maybe help them identify other differences in their genetic makeup. You know, maybe they're not doing anything different than that person, but they may have different gene sequences that protect them more from this particular disease. You know, we don't know, but you know, they can talk with their doctors, their medical doctors about the progression, but we do want to encourage them to focus on what they have right now. Instead of focusing on their friend that lost the battle, focusing on how they're winning the battle at this moment. Beginning medication comes with it because of, you know, not only the fact that you're taking medication and acknowledging that, okay, I've got this, I got to do something about it. You know, that can be a huge grief, anger, depression issue. But also the side effects can be another issue that can initiate relapse, because if the side effects of the medication are contributing to fatigue and lethargy and, you know, nausea, then people may start feeling hopeless and helpless and, you know, not wanting to live. So we do need to make sure that we're doing assessments for suicidality more frequently. If they have little or no response to various medications, this is a huge issue for contributing to hopelessness and helplessness. We want to try to continue to promote the notion of hope. We want to continue to reinforce what they're doing in order to at least prolong their high quality of life. And with blood tests, a decreasing T cell count or increasing viral load can also contribute to feelings of impending doom and hopelessness and helplessness. So what do we do? Well, we already talked about take your medication, get tested, intervene early, practice, you know, good hygiene so you're not getting exposed repeatedly. In addiction treatment, we talk about HALT, hungry, angry, lonely, and tired. And in order to help people prevent relapse for their mood or their addictive disorders, we need to make sure that they're getting adequate nutrition. So their body has the building blocks it needs to have a healthy immune system, to make the neurotransmitters for happiness, to make the neurotransmitters for their endogenous opioids to help control some of the pain. Relaxation and stress management can help with the angry or the anxiety part, encouraging people to develop skills to tamp down or to relax that HPA axis. When their anxiety and anger and their HPA axis stay revved up, again, they're reducing their immune system and increasing systemic inflammation. Both of those are going to work against a positive recovery outcome. Grief management. When you're diagnosed with a chronic illness, there is potentially an element of grief, especially if it's one that can't be cured. But even if it is one that can be cured, there's a period of grief because, you know, maybe you thought you were invincible or you thought you'd never get that. So we do need to explore with clients the notion of grief. Recreation attends to both the angry and lonely part of HALT. We want to make sure people are getting out. They're having fun. We've talked before about the bath. You know, if they feel like they're running hot water all the time because they're stressed out, you know, help them turn up some of that cold. Make the bath a little bit more tolerable. Encourage them to do things that stimulate their relaxation and their positive emotion neurochemicals. Recreation also encourages people to engage with others, you know, and do something fun. You don't have to just engage with others in support groups. But now we come down to support groups, and that is important for people, especially if they develop chronic hepatitis B or C or HIV, to have access to peers who are going through similar things so they can normalize what they're going through and get support. Family counseling can be helpful if it is culturally appropriate. because it can help the family understand what's going on and help the family develop tools to support the person with the disease. Sleep is super important. You know, we need to make sure that the body has time to rest and repair. And then medical intervention for pain. And it can be pharmacological, like opioids, not my favorite choice, but it can also include nerve blocks and acupressure, acupuncture, hot, cold. There's a lot of non-pharmacological interventions that can be used to help reduce some of the pain. Group therapy. Consider organizing separate groups for clients that are newly aware of their disease status. They're going to be dealing with different issues than clients who are asymptomatic or mildly symptomatic. You know, so at first there's this feeling of crisis and maybe impending doom and anger, and there's a lot of really powerful emotions. And then you may have clients who don't have a lot of symptoms and they're just like, you know, it is what it is, but they may need some support and to comply with their treatment regimen. If you're not having a lot of symptoms, sometimes it's hard to see, well, why should I keep doing this? And then clients with more advanced disease are going to have their own issues that they may need to be dealing with, such as, you know, if they've been diagnosed with liver failure or their T-cell count has gone below 100, you know, they are facing some very significant, potentially life-threatening issues that they're going to need to cope with. Additional precautions. If you are a therapist, you know, when I worked in residential, we would do searches of rooms, of persons, and of luggage. So when searching clothing, people, or possessions, be cautious of broken glass or needles, which could be hidden. And it's probably not malicious. They probably just forgot it was there, but it's easy to get stuck. If you're extracting a person from a car or other critical situation, be aware of all broken glass and sharp edges. Always have disposable mouthpieces and non-latex gloves available in the event that CPR is needed. And this is true for mental health counselors too. Make sure you have what you need in your office in case you have a client who falls out and you've got to give them CPR. Post-exposure treatment ideally should begin within 1 to 2 hours, especially for HIV, encouraging people to go get tested. HIV, AIDS, and hepatitis counseling and education should be available at the treatment facility and every physician's office. We need to educate people about how to prevent it, what it is, the fact that there are very workable medications out there right now, and people are living long, rich, and meaningful lives, and, you know, quality lives, even with HIV or hepatitis. Patients receiving adequate early intervention obviously live longer and healthier lives. To find out more about the universal precautions, you can go to the Guidelines for Environmental Infection Control in Healthcare Settings by the CDC. That's a whole publication, and it just goes over universal precautions. I figured y'all have probably been through that class so many times that there was no need to be redundant on that in this class. So hopefully you've kind of gotten an idea about the fact that, you know, a lot of our clients actually probably do have hepatitis or HIV, and we need to be sensitive to how that's impacting their emotional, cognitive, and physical recovery. And we need to be sensitive to some of the issues that they are facing, from shame and grief to chronic pain and difficulty sleeping because they're in chronic pain. Are there any questions? Alrighty, everybody, thank you so much for being here today. And again, the World Hepatitis Day is not until the 28th of the month, but I did want to get this out here ahead of time, so you had a little information in case you decided you wanted to do something, you know, fun and exciting for your clients in honor of World Hepatitis Day. So have a great day, and I'll see you on Thursday. If this podcast helps you help your clients or yourself, please support us by purchasing your CEUs at allceus.com or getting your agency to sponsor an episode. A direct link to the on-demand CEUs for this podcast is at allceus.com/podcast CEUs. That's allceus.com/podcast CEUs. To sponsor an episode of Counselor Toolbox and reach over 50,000 clinicians per week, go to allceus.com/sponsor. Thank you.